Welcome to 5 Minute School, and in this video we're going to be talking about peptic ulcer disease. So this is a disease where ulcers develop in areas of the gastrointestinal tract or the digestive tract which are in high contact with the acidic gastric juice. So if you don't know what an ulcer is, it's a lesion which kind of looks like a crater. I'm going to put a picture of it here. So when a person has a peptic ulcer, it can result in bleeding, which is a complication of having a peptic ulcer, and if there is an excessive amount of this bleeding, it can lead to a type of anemia. There are three common causes of a peptic ulcer. The first is a bacteria called Helicobacter pylori, and this is the most common cause of peptic ulcer disease. So this bacteria has several adhesion proteins so it can attach itself onto the gastric cells of the stomach. It has an enzyme called urease, which breaks down urea into ammonia and carbon dioxide. The ammonia produced helps to protect the bacteria from acidity of the stomach, and it also damages the protective mucus layer of the stomach and the gastric cells. It also produces an enzyme called catalase, which protects the bacteria from phagocytosis by the neutrophils. So to summarize, the Helicobacter pylori is basically damaging the lining of the stomach, causing these ulcerations, which is why the complications of peptic ulcer disease occur. The second cause of peptic ulcer disease is excessive hydrochloric acid secretion. Now, higher concentrations and higher volume of hydrochloric acid can occur in diseases like Zollinger-Ellison syndrome, and it damages the protective lining of the stomach. And this excessive amount of hydrochloric acid can damage the protective lining of the stomach and gastric cells because the amount of acid is more than what the body can resist. The third cause is non-steroidal anti-inflammatory drugs like aspirin. Studies show that these drugs irritate the lining of the stomach. They impair the barrier properties of the mucosa, and they increase suppression of anti-inflammatory gastric prostaglandins. They reduce gastric mucosal blood flow, which also affects the defense and repair of the lining of the stomach. So those are the three main causes of peptic ulcer disease. Now we're going to talk about how it's treated. So in terms of the treatment of peptic ulcer disease, if the cause is due to Helicobacter pylori, antibiotics are usually the first line of treatment. Additionally, reducing the intake of non-steroidal anti-inflammatory drugs is also recommended. Oral antacids are usually a temporary form of treatment because they buffer the gastric acid. If we have hypersecretion of hydrochloric acid, we can use H2 blocker medication or proton pump inhibitors like omeprazole, which block the secretion of hydrogen ions from the parietal cells of the stomach. Additionally, there are some therapeutic options like reducing alcohol and caffeine intake and reducing cigarette smoking. These are recommended because these habits can impair the mucosal defensive mechanisms.